You and I both know it's not just about getting people in the door, but it's also about keeping them there. Talk a little
Yes,
bit about retention strategies.
absolutely. That is something that also probably wasn't thought of that much, 20 years ago. And because people stay in healthcare. But now they know there's so many more choices and they get exposure to the choices. You're right in that we have to really put that attention to retention. So some of our newest initiatives is really making sure that we're providing them a long-term career path. For nurses, we have a clinical path, a clinical ladder for them to upskill, learn new specialties, be able to keep up with the market and their own skills, and so that they can go down a different path. We have all kinds of tuition education programs where they don't even have to put out money anymore, that those can be direct billed to us so that they can further their education. But then we're looking at those programs where that entry level person who maybe is working the front line as a greeter at a hospital can work for us while they go to school. And then they can continue to, if they would like to go be a nurse, if they want to be a surgeon, whatever that looks like for them, they can go to vocational school and become a surgical tech. They can work for us and take advantage of those programs, which really lends to that retention, but also just our values. And that helps with retention immensely.
This question is maybe a little bit tactical, but I'm kind of a data person. So I'm just interested through the acquisition as well as retention, what sort of key metrics do you look at to know that you're, doing well?
Oh, well, that's definitely my sweet spot. We in talent acquisition, we measure over 60 different metrics, really from start to finish, from the time that the candidate even express interest. For example, we know that a candidate, before they ever apply, touch or see us at least 8 to 12 times. So they may see us on an ad, or they see us in a retarget ad, or different places that they touch and see Advent Health before they actually apply. And so from there, it's really measuring each step of the process for them all the way through to the point that they actually start. For talent acquisition, it goes up to that start, and then HR picks up their onboarding experience and then the retention for them afterward. They have additional metrics. We'll do like 90-day surveys and yearly surveys to gauge how are they feeling as employees, and relate that to additional skill sets and things that we can provide to them. So there's great attention to looking at the metrics and understanding the why, what is happening, and particularly we look at shifts in metrics. The big if there's something happening in a particular market, is there a high turnover in a particular department? Why is that happening? So we have our HRS team created an awesome, what they call like a heat map, which they took a great amount of time to study all the reasons why people leave and what might be happening before they leave. Are they applying for a large number of jobs internally? Have they called the help desk and wanted to know about changes in benefits, or all these different things that kind of play into somebody, what might lead them to want to resign? And so they measured what are those triggers, if you will, that might lead to that, did they do well on their evaluation? And so that they can measure, this might be a person. It will produce a high risk list to a hiring manager to say, this might be a person that might be looking. How many times have they applied on an internal job? We have those frequent appliers. And if somebody's applying to 30 jobs in the last month to go move somewhere else, clearly something is happening. And so we
Right.
pay a lot of attention to those triggers.